Let, let me make a request that as we start, a number of us on the committee have been discussing amongst ourselves that we're having a little bit of trouble taking notes quite as fast as we would like to be taking it, and the presentations and discussions have been extremely rich. Therefore, if any of the people who have been or will be speaking have like a copy of the slides or the the items you recommended listed, if you could give that to us, that would be extremely helpful, because some of us are feeling like you can take notes as furiously as you can, and the input has really been very, very rich this morning. So just anything you've got that you want to give us that we can work from would be very helpful. That's my speech. And now back to Stephen Hargitay in 1 minute. I want to introduce Hendrix Brown, who's the one member wasn't able to be here yesterday, and we're delighted to have you with us today. Say something brief about from whence you come and stuff.
Yes, I'm a professor at the University of Miami, and I direct a Center for Prevention Implementation Methodology that's supported by NIDA for drug abuse and HIV prevention, as well as a number of NIMH grants on methodology for synthesizing findings across randomized trials.
And now, Steve.
Yeah, thanks, Alan. But I want to get clarification potentially from Patrick as well about the written communication or slides. If are these a matter of public record, the slides are. Is that correct?
Anything that we receive in writing goes into the public record.
Great. And so we can go back to these slides as well, though, for our review, as Alan has suggested?
Oh, yes.
Great. Thank you. Okay, well, thank you. Welcome back, everyone. And welcome back, everyone. I hope you enjoyed your lunchtime. We have another very, very great panel for you this afternoon, and we have a great diversity of presenters, and we're going to get right into it to allow for maximum participation in the discussion period. We're adhering to the same principles of timing for our panelists to adhere to. We are also, again, encouraged and really want to make sure the committee members see this as an opportunity to probe these panel members for their ideas about informing our work in developing a research agenda for gun violence for the CDC. So our first presenter, Julia De Silva, Director of the Violence Prevention Office of the American Psychological Association.